welcome to the Body Shop Physical Therapy. My name is Catherine Price. I'm a physical therapist. I'm going to go over the Egoscue Method for chronic knee pain related to femoral internal rotation, or common posture would be knee knot. Before I begin, I'm going to speak a word of life from Philippians 4:8. Finally, brethren, whatever things are true, whatever things are noble, whatever things are just, whatever things are pure, whatever things are lovely, whatever things are of good report, if there is any virtue, and if there is anything praiseworthy, meditate on these things. Amen. So please consult your medical doctor or physical therapist for the appropriateness of exercises for you. This is going to be a menu of exercises to take you through to help with postural alignment of the legs, and especially related to alignment where you have a femur that is turned inward. So if I am standing and I take my femurs and I turn them inward, I usually am going to see the kneecaps facing each other, and it's going to be a knee knocked position. So it's just not always this way, but if I turn my femurs inward, I am going to see the legs pointing inward. And in this deformity, we call this a valgus deformity, you'll wear the outside of that knee. So we want to realign the knee so that it is moving smoothly and wearing evenly on both sides, so that we can prevent those arthritic changes that occur when there is not good alignment. So I'm going to take you through this menu of exercises. I'm going to use a timer. I have 2 blocks that I'm going to use. A pillow will work just fine, and I will take you start to finish. We're going to begin with the standing wall with block, and so I'm going to set my timer for 6 minutes. You want to come up to your wall with your heels against the wall. You're going to place your pillow or the block right between your knees. The toes are going to be facing forward, and you want your upper back and your hips to be against the wall, and you want to keep the thighs tight. So I'm going to tighten my thighs, keeping my feet forward, and I'm going to keep my hips and my upper back against the wall. My shoulders, you're not forcing your arms against the wall, and you're not forcing the head back against the wall. You're letting the arms relax down by your side, and you want to keep your abdominals relaxed. This is going to be a 6-minute hold. You can hold anywhere between 6 and 8 minutes, and the whole time you want to keep your thighs contracted and tight. I'm not squeezing the block, but I am just having enough pressure to hold it in place, and tightening my thighs usually does that. So as I stand here and hold this, I'm just going to work on my diaphragmatic breathing. So I'm going to breathe in from my ribs, my lower part of the rib cage, and I want my ribs to anchor against the wall when I do this. So I don't just want my belly going forward. I want my ribs to expand, and I should feel them pressing back into the wall when I expand my rib cage. So we've got about 4 minutes left to go. 6 minutes is going to feel like a long time. Check back in, make sure you're keeping the thighs tight. It's easy for me to let my thighs go, so I have to focus on contracting my leg muscles as I stand here. So keeping the thighs tight, taking a breath in, all the way out, breathing in, all the way out. So what this is doing, it is repositioning all of the load joints. So it is helping to align the body all the way up and getting those load joints repositioned so we can evenly distribute the weight throughout our joints. So taking a breath in, all the way out, almost halfway there. hips against the wall, the upper back is against the wall. Breath in. Keep the thighs tight. I can feel that I let my thighs relax and I have to focus on keeping them contracted. About a minute and a half left to go. Five seconds. Seems like a long time. Staying relaxed in the abdominals, tighten the thighs. 3, 2, 1. Okay, the next is going to be the wall stork. And to do this, I'm going to use a chair so that I can put one of my legs at a 90 position. So here it's a little bit high, but I want my knee and my hip to be bent to 90 degrees. My standing leg is going to be against the wall. You want the heel to be right up against the wall. You want to tighten the thigh on the leg that's standing. And then on the leg that is up, I want to make sure that my hip and my shoulder on the leg that is on the chair in the 90-90 position, I want that shoulder to be flat against the wall and my hip to be up against the wall. So the hip and the shoulder on the leg where the that's up is going to be up against the wall. The upper back is against the wall. And then I want my thigh to be tight on the standing leg. I've got my timer set for 3 minutes. And so we're going to hold 3 minutes each side here. So upper back is against the wall, shoulder and the hip on the side where the leg is 90-90 is going to be pushed up against the wall. And holding this for 3 minutes. Again, focusing on the breath. You want to keep the abdominals relaxed, taking breaths in and out. keep the side where the leg is up, keep that shoulder and hip against the wall, and keep the thigh tight on the standing leg. Thirty seconds to go. And then I'm going to bring the right leg down. The heel is going to be against the wall now, and the left leg is going to be up on the chair at a 90 degrees. I'm going to now make sure that I have my shoulder on the left side and my hip on the left side against the wall. I want my upper back and then my leg that is against, with the heel against the wall to thigh to be tight. So the leg that is down standing, the thigh is going to be tight, and the shoulder and the hip on this leg that is up is going to be against the wall, keeping the upper back against the wall and holding this position for 3 minutes. Taking deep breaths in and out. Keep the thigh tight on the standing leg. Keep the shoulder and the hip of the leg that is up against the wall. Keep the thigh tight on the standing leg and make sure your toes are facing forward. Almost there. 45 seconds to go. Keep the thigh tight on the standing leg. Okay, so that is wall stork. The next exercise is cats and dogs. So I'm going to place my hands underneath my shoulders, my knees underneath my hips, and I want to go through 10 smooth movements, rounding out my spine, dropping my head down, and then arching my back and looking up. That's 1, 2, 3, 4, 5, 7, 8, 9, and 10. Last one. After cats and dogs, I'm going to do lying supine, so I'm going to use one block, and I want to set my timer for, this can be anywhere between 3 and 5 minutes, so I'm going to set the timer for 3 minutes, and I want to lie flat onto my back with my arms out at 45 degrees. So I'm on my back, my arms are out about 45 degrees from my body, and then I want to hold the block between my ankles with my toes pointed towards me. So I'm going to keep my thighs tight and pull the toes back towards me and just hold this position for 3 minutes. While I'm here, I'm going to work on my diaphragmatic breathing, so I'm going to breathe from the bottom of my rib cage, taking a nice deep breath in, all the way out. Deep breath in, all the way out. And just holding this position for 3 minutes, keeping the toes pointed towards your head, so pulling those toes up and holding the block with your ankles. You don't have to squeeze hard, just enough to apply pressure and hold. And keeping the legs straight, thighs tightened. Seconds to go. Okay, so that is supine, lying supine. Next is going to be modified floor block. This is another 6-minute holds. These are long hold positions. And for this one, I want to use 2 blocks, and I'm going to bring them, I can start here if I need to, and then I want to work to where I have got my arms up on 6 inches. So I'm going to lie on my stomach. I want to keep my feet in line with my hips, and then I want to go into a pigeon toe position. I'm going to lie with my forehead on the floor, and then my arms are going to be at a 90-90 position. So I'm going to rest my my forearm on one block and my forearm on the other. And I'm just going to lie in this position and take diaphragmatic breaths in and out, holding for 6 minutes. And you may get a stretch across the chest when you do this. I'm just going to let my arms relax on the blocks,
Taking deep breaths in and all the way out.
Make sure that your feet are in that pigeon toe position.
And hold. Relax your abdominals. Relax your back. Taking deep breaths in and all the way out.
Make sure you keep your feet in that pigeon toe position.
Elbows and shoulders 90-90.
Two minutes to go. If you find that it's hard to breathe, you can use a towel roll to put underneath your forehead just to relax your forehead. Seconds to go. Then I'm going to go back into cats and dogs. The knees are underneath the hips, hands underneath the shoulders, 10 smooth movements, alternating back and forth. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And the last exercise is a wall sit or an air bench. And what I'm going to do is come up against the wall. I want to keep my toes facing forward. I'm going to drop down until I'm in a 90-90 position. My back is going to be against the wall, and this is going to be anywhere between 1 and 3 minutes. I want to keep the upper back against the wall, my hips against the wall. You're going to feel the back against the wall. You're going to push with the legs. Your toes are facing forward, and you just want to relax your arms and shoulders and hold this position. You can keep the abdominals relaxed too. All the work should be through the legs. And if this is painful in the knee, you want to rise up until you have no pain in the knee. There can be a little bit of pressure from the stress that you're placing on the thighs, but most of the work should be on the top of the legs. And just holding this position, you can build up to 3 minutes, but we're going to hold anywhere between 1 and 3 minutes. It's almost been a minute. Taking deep breaths. 3, 2, 1. So that's 1 minute. We're going to go into the second minute, working on our breathing. Deep breath in. You're halfway there to three minutes, and deep breath in. Keeping the back against the wall, abdominals relaxed as best as possible, upper back, hips against the wall. 9, 8, 7, 6, 5, 4, 3, 2. You're in your second minute, so that's completing the second minute. Now we're going into the third minute, and so this is the last minute to hold. Keep your shoulders relaxed. Toes are facing forward, hip width apart. 30 seconds to go. Seconds. All right. So that completes the menu of exercises for chronic knee pain that is going to be associated with either one or both of the femurs internally rotated, so turning in. And this can be either just the posture of that internal rotation, or it can be pain associated with that as well. I hope this is of help, and have a blessed day. Thank you.